Hello, I am Dr. R.G.Holla. I am a senior consultant in neonatology and pediatrics at Rosewalk Hospital. One of the common problems that parents face with a newborn baby or with a small infant is crying. Crying is such a difficult thing for people to interpret. Sometimes it becomes very difficult for them to know what to do. So let me talk about babies who cry. Now, first of all, understand that all babies cry. It's their only means of communication. Babies cry when they are hungry, but more often than not, they cry either when they want body contact, they want to be picked up, they are uncomfortable in the clothing that they are wearing, they have some discomfort inside their body, or they have a blocked nose, or they are having reflux. Usually these are the common causes of crying. In addition to that, one must keep in mind there could be serious underlying diseases which could lead to crying. Now, every time a baby cries, it's very important to try and understand whether this is a normal cry because of just discomfort or fussiness, or whether it is a serious illness. If the baby has a blocked nose, or if the baby is having reflux or wants body contact, the simplest thing to do is to pick up the child on the shoulder and try to comfort the child. Most babies, they settle down with this sort of a body comfort, and that tells us that this crying is not abnormal or pathological. Sometimes it happens in winter, we tend to overclothe the child, or sometimes the baby is wearing less clothing. That also causes discomfort. So as a parent, one would look into these aspects also. Of course, if a baby has not been fed or is being underfed, that could also aggravate crying, but that would be associated with other symptoms like less urine output or less stool output. Now, finally, we come to the pathological causes where babies cry. Many times they cry after being given an injection. The routine vaccinations can sometimes cause excessive crying or irritability. If a baby is running fever, that baby will be highly irritable. If the baby has got pain in the ear or pain elsewhere in the body, either because of an injury or because of an illness, that could cause crying. And of course, serious illnesses like meningitis can also cause crying. In those situations, when you pick up and try to cuddle your baby, when you try to comfort the baby doesn't get comforted easily. So those babies are the ones who need to be taken to the hospital and shown in an emergency situation. So please remember, any baby who has got consolable crying, that means the baby becomes quiet by picking up, it's probably just the usual repertoire of a baby's language that he or she is expressing to you. Thank you.